Busting myths about your smile. Many people believe that if your gums bleed a little when you brush, it just means you are cleaning your teeth very well. This is a common idea, but it is not quite right. Bleeding gums are often a sign your mouth needs a little more gentle attention. Think of it like a quiet alarm bell telling you to check in on your oral health. My name is Dentist Judith, and I am here to be your friendly guide through dental care. My goal is to help you understand your smile better, without fear or confusion. We'll explore questions you might be too shy to ask, and I'll give clear, simple answers for you and your family. Over the years, I've heard so many worries from patients of all ages. It's completely normal to feel uncertain about what's happening inside your mouth. A child's first tooth, an adult worried about bad breath. These topics matter to your overall health. Today we'll tackle 4 common questions: why gums might bleed, whether fluoride is necessary for children's teeth, what causes persistent mouth odor, and whether sugar-free gum can help prevent cavities. Each topic holds a key to a healthier, more confident smile. A common myth I often hear is that bleeding gums are normal, especially if you brush your teeth with a lot of force. The truth is quite the opposite. Your gums should not bleed when you brush or floss. Healthy gums are firm, pink, and fit snugly around your teeth. If you see blood in the sink after brushing, it is often the first sign of a condition called gingivitis. Gingivitis simply means your gums are inflamed or irritated, usually because of a buildup of plaque along your gum line. This is your body's way of saying your gums need extra care to get back to a healthy state. When plaque sits too long, it hardens into tartar, which you cannot remove with a toothbrush alone. Brushing too aggressively with a hard bristled brush can also damage gums. Most bleeding signals an underlying plaque issue, not that you cleaned well. It is a signal to adjust your technique, not to stop brushing the area. Switch to a soft bristled toothbrush. A soft brush cleans plaque effectively and is gentler on gums. Use small circles, bristles angled 45 degrees toward the gum line to sweep plaque away without irritation. It is also very important to floss gently every day to clean the spaces your toothbrush cannot reach. These simple adjustments can significantly improve gum health. Be gentler and more consistent with brushing and flossing. If bleeding continues for more than a week or 2, it is time to see your dentist. A professional cleaning removes hardened tartar you cannot at home, giving gums a chance to heal. We will also check for other causes and show you the best techniques for your needs. Addressing bleeding gums early prevents more serious problems down the road. It is a simple step toward a much healthier mouth. There is a persistent myth that fluoride in toothpaste is an unnecessary chemical and that children should avoid it. However, decades of scientific research tell a very different story. Fluoride is a natural mineral that is incredibly effective at protecting teeth from decay. It strengthens enamel and makes it more resistant to acid attacks that cause cavities. Think of it as a vitamin or invisible shield for teeth. For developing teeth, fluoride is crucial in building a foundation for a lifetime of healthy smiles. Its benefits are well documented and recognized by dental and medical professionals worldwide. When your child brushes with fluoride toothpaste, the mineral is applied directly to teeth. It helps remineralize and rebuild areas weakened by acids. It can even reverse the earliest stage of decay before a cavity forms. Using fluoride toothpaste protects baby teeth and the permanent ones that will follow. Under age 3, a tiny smear, about a single grain of rice. Safe even if swallowed. From 3 to 6, a pea-sized dab, and encourage spitting after brushing. Supervise to ensure the right amount and good habits. The consensus is clear. Fluoride toothpaste is a safe, essential tool for preventing cavities in children. If you have concerns, speak with your dentist or pediatrician. We will tailor guidance to your child. Section 4. Unmasking mouth odor. What your breath is trying to tell you. Many believe halitosis comes from the stomach. While possible, it is quite rare. About 90% of cases start inside the mouth. Bacteria live on your teeth, gums, and especially your tongue, breaking down food particles and releasing sulfur compounds. Foods like garlic and onions can trigger odor. Poor oral hygiene lets debris linger and bacteria thrive. A dry mouth, xerostomia, is a major culprit. Saliva washes particles and neutralizes acids. With low flow, bacteria multiply. That is why morning breath is common after reduced saliva overnight. Stay hydrated throughout the day. Clean your tongue from back to front. Do not forget your tongue. Brush twice a day and floss daily. If odor persists, schedule a visit. We will check for cavities, gum disease, or other conditions. The sweet truth about sugar-free gum. A cavity-fighting ally? Not all gum is bad. Sugary gum can harm teeth, but sugar-free gum can help, especially when sweetened with xylitol. It works in 2 ways. First, chewing stimulates saliva to rinse food particles and neutralize acids, protecting enamel. Second, cavity bacteria cannot use xylitol for fuel, so they fail to produce damaging acid. Over time, their levels can drop. Chew sugar-free gum for about 20 minutes after meals or snacks, when acid levels are highest. Saliva kickstarts cleanup and neutralizes acids faster. It is a convenient helper when you cannot brush. Remember, gum supplements your routine. Brush twice daily with fluoride toothpaste and floss daily. Used correctly, it helps keep your smile healthy and bright. Section 6. Your simple path to a healthier smile. Bleeding gums do not mean you brushed hard. They warn of inflammation from plaque. Use a soft brush and gentle technique. For kids, rice-sized under 3, pea-sized from 3 to 6. Bad breath usually starts in the mouth. Clean the tongue and drink more water. Sugar-free gum, especially with xylitol, helps after meals. Use these to supplement daily brushing and flossing. My call to action: brush 2 minutes, twice a day with fluoride toothpaste, and floss once daily. You are not alone. Your dental team and I are your partners. Thank you for spending this time. Keep smiling, keep brushing. You are doing a wonderful job. With warm wishes, Dentist Judith.